Good morning, everyone. Today, I want to talk to you about situations where you have patients, especially professional patients, could be like a doctor, a lawyer, a CEO of some company, or someone who is in a very busy profession. And you try to book them in, let's say they need a crown or a filling or some periodontal treatment or something. And you try to book them in, and they always give you the line of, which is true, like I'm very busy, like I can't come in the next 3 or 4 weeks. Oh, what about in 7 weeks? I can only come at Monday at 6 p.m. and you only finish at 5 p.m. for 8 to 5 practice, for example. I'm fully booked I'm busy in 6 weeks, I can't come in the next 8 weeks or whatever. And they are genuine because they are busy, and they got their mindset that they are busy. You find it very hard to book their appointments and very hard to finish their treatments. The treatments just keep dragging, especially if you need to see them for multiple appointments. And how can you respond to that, whether you work in the front office or you're dentist in the room booking the patient, or you want to manage this with the patient? First, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa, here in Hervey Bay in Queensland, and you can check my details below. And I took my practice from 1 chair to 10 chairs over the course of 14 years. When we started, we were a team of 3 staff members, and now we're close to 40 staff members. So when I'm faced with those questions, the worst thing you could do is agree with it, like, that's fine, let's book you in 8 weeks, and then they book in 8 weeks, they might cancel, and then that's like 9 weeks now, that's 10 weeks. So small problems that you planned for, let's say you plan for a filling, it can become a root canal treatment, for example, or if it was a root canal treatment, it can become an extraction. If it was a crown, it becomes a root canal treatment and a crown, or if it's a crown, it could be an extraction. Whatever the problem is, it could be a lot worse and a whole different plan now, and you have to change your appointment time, and it just becomes very chaotic for you to manage. So the worst thing is to agree with it. So what I will do, I use a bit of a direct approach, especially with those professional patients, and because again, it's for their benefits more than anything else. Your intention has to be clear that you're doing that for their benefits. So I will tell my patients, look, I understand you're very busy. I understand. I'm same like you. I'm in a profession where I work 8 to 5. I'm fully booked for weeks in advance, and I get an appointment available every now and then. Yes, but when it comes to my health, I put it first. I will shuffle things around. I will have to move things with my work. I will have to block time. I will make my health a priority, because if I don't make my health priority and I drop down, my patients will suffer. All my patients, I'm trying to be there for them. I'm not going to be able to see them. So you're saying you're busy. I agree with that. I understand that. But I have a feeling you're not putting your health first. You need to look after yourself a bit more. So you're becoming their coach a little bit now. So how about picture that? This filling, agree with you and wait for 8 weeks because you're busy. And because we're waiting for 8 weeks, let's say next week, you bite on the wrong spot and the tooth cracks in half, and now you're in severe pain. It's an emergency pain. So now you will have to probably cancel a few of your patients in the morning, or a few of your appointments in the morning. You have to come in. We have to fit you in an emergency appointment somehow. And you might end up losing a half day of your work just because of the pain. Worse, let's say you have this tooth that we want to do a root canal treatment, and we don't treat it or catch it on time, and wait for 2 months and 3 months until you have availability. You end up being in the hospital, hospitalized for an infection that's spreading into your soft tissue there. So you might lose a whole day of work, sometimes even 2 days in the hospital, just trying to drain this infection out. I would hate to see this happening to you, but I've seen it happening with my patients before when they delay treatments. So I am sure there's a way you should be able, within your work or your profession, to manage it differently so you can put your health first. I want you to be healthy. I want to be available for your patients or your clients. So what can you do differently to come a bit earlier than 8 weeks? Because I don't think this problem will last for that long. Again, you're being their coach. You are their health personal trainer. You're raising their concern. A lot of patients think problems can wait, but in dentistry, some problems can wait. It's okay. Like if it's very, very super elective cosmetic procedure, it's fine. But most of our problems, periodontal treatments, root canal treatments, crowns, cracks, fillings, those problems are very unpredictable. It could be okay for 3 months, but it could flare up in 1 week or 2 weeks. So if you have availability for the patient and you can coach them to put their health first, you'll do them a great favor. Don't agree with them. Don't downplay, like, yeah, it's fine, it can wait for 3 months. No, sometimes it cannot. Make sure you raise enough concerns, be direct about it, and be their coach. Have a warm, friendly voice. You're there to be their friend You're there to be their coach. You're not trying to talk down on them or demand them to cancel their appointments with patients to come and see you earlier. So try this approach and let me know how it goes. And if you have a different approach, share it with me. If you find this information helpful, make sure you like and share it with your friends and colleagues. Please subscribe to my channel so I can provide you with more information. And if you turn the notifications on, you will be notified when I release more videos. Thank you so much, and it means a lot to me that you listen to me.